Hi, I'm Nan Roman from the National Alliance to End Homelessness.
And I'm Marc Jones from the National Innovation Service.
Marc and I have worked together with a handful of other national leaders to create a framework for an equitable COVID-19 homelessness response. This framework is based on things that we feel confident work. We hope it can help jurisdictions use their federal stimulus money to address the public health and economic recovery issues of people experiencing homelessness during the pandemic.
We see this moment as an opportunity to bolster existing efforts and to use new funds to help communities emerge from the pandemic even stronger. The framework is grounded in the following principles. First, advance racial justice and equity. We know that many communities are struggling, but both homelessness and the pandemic highlight the racial inequities that persist in our nation. Black, brown, and Native folks are disproportionately impacted, and new funds should be explicitly used to eliminate racial disparities in our systems. Second, address the highest needs first. People who are unsheltered, older, disabled, medically fragile, literally homeless, and extremely low income should be helped first. Start by addressing needs of people who are currently experiencing homelessness as their conditions are exacerbated by the pandemic. By committing to helping the people who are already homeless and at highest risk of illness and mortality from the virus, scarce resources will achieve better results.
Third, get people into housing. This crisis proves that housing is healthcare. People can't socially distance, self-quarantine, or practice hygiene if they don't have a home. Neither can they look for or hold a job. Getting people quickly into a home will protect them, improve their health, and reduce community spread. It will help them take care of their kids and get back on their feet in the post-pandemic period. Fourth, build strong partnerships. Homeless programs can't do all of this alone. Both homelessness and the pandemic cut across sectors and systems. Serious, strong partnerships will have to be formed between homeless organizations and housing and health departments, businesses, and others. And always, they'll have to include people in impacted communities and with experience of homelessness.
And finally, act quickly. We know that the business as usual approach will not work. We must pursue immediate actions to save lives in the context of the pandemic while simultaneously building towards enduring improvements. The framework will help you be more successful in making the wisest decisions with limited resources in a time-constrained environment. We have the opportunity in this moment to fundamentally transform our housing and homelessness systems to be truly responsive to the needs of the most vulnerable and marginalized populations. Our hope is to seize it.
So keep an eye on the Alliance website, endhomelessness.org/framework, for updated versions of the framework. And we're also going to be posting there a lot of tools and other information that will help you implement these recommendations. Also, if you have questions, reach out to us at framework@naeh.org, framework@naeh.org. And remember, advance racial justice and equity, address the highest needs first, get people into housing, build strong partnerships, and act quickly. As always, thank you so much for your hard work on behalf of people experiencing homelessness.